All right, hello everyone. I'm Harry Gould, the current president of the Southern Pain Society. I'm here with Dr. Scott Fishman, professor and Fullerton Endowed Chair in Pain Medicine for the Department of Anesthesiology and Pain Medicine at the School of Medicine of the University of California at Davis. Dr. Fishman is an internationally recognized physician, speaker, and advocate for the safe use of medications in the management of pain, and he will be presenting the opening address for the virtual presentation of the Southern Pain Society's 34th annual meeting on March 12th. His address is entitled Updates on Guidelines and Regulations for Opioid Prescribing. Since the CDC released its guideline for prescribing opioids for chronic pain in 2016, the practice of managing pain and the guidelines themselves have evolved and adjusted to meet the needs of the patients and physicians alike. Dr. Fishman, from your perspective, how have the guidelines affected the practice of pain medicine?
Well, thank you, Dr. Gould. The guidelines had a significant impact on the practice of medicine, but it's interesting that if you look at what the guidelines said when they first came out, there was really very similar to advice that had been given to clinicians much earlier. And even prior to the recognition that we had an opioid crisis that was in part due to excessive prescribing of opioids. So the guidelines went a long way to articulate and codify very clear expectations that patients who were prescribed opioids would have thorough evaluation, risk management, continuity of observation, that we wouldn't just set it and forget it with these patients, because with pain, it's very easy to come to the assumption that we can't prove that anyone does or doesn't have pain, and therefore we can't prove that anyone does or doesn't have pain relief. So we give them opioids, we just give more if it doesn't work, etc. It was a very, very loose system, despite the fact that many of us were advocating for safer prescribing and vigilance. The state medical boards had guidelines from the Federation of State Medical Boards prior to this, but I think the CDC guidelines really articulated things well. They put it into terms that clinicians could understand very readily. They addressed the use of opioids in the acute pain setting, which had never been addressed before, which was important. But unfortunately, the guidelines also had some unintended consequences where physicians who I think felt overly open to prescribing now felt very concerned and would suddenly discontinue patients or involuntarily taper them. And we found that by doing that, even though we were abiding by rules that were supposed to be harm reducing, there was harm associated with that. So even since the CDC guidelines have come out, they had to be revised to admonish us to be careful that while we're trying to reduce harm, we can cause harm. And we want to actually weigh and balance that, because at the end of the day, what we do with these drugs, it's not just opioids, is balance benefits and risks. And that's what I think we've come a long way with in the whole opioid debate.
Great. And so how do you think the guidelines have met expectations, or haven't they? What is your thinking about that?
Well, I think we're evolving. I think that was a major evolution to, I think for very good reasons, to consider opioids as a possible treatment. We overemphasized inadequate data in overusing them. We thought they were safer than they were. And then I think we've maybe over-responded a little bit. But really, these guidelines have let us understand that opioids are really for those exceptional cases where everything's been tried and failed, and you have a patient who is compliant and has a relationship with a prescriber and can safely use these drugs. So I think that those expectations have been met, but I think we're coming to an understanding that each patient's an individual. These guidelines are just that, guidelines. But we as the clinicians are necessary for medical judgment that goes into using these guidelines and finding the right balance for our patients. So with that, I think we're still in evolution on what exactly that is.
Yeah, sometimes the guidelines have become rules or regulations that must be followed in some way. And I like your idea of each patient is an N of one. They don't always fit into the round hole of the square hole. And so we have to approach each one individually. So what do you hope the participants will learn from your talk to help them with their practices to provide better care for their patients?
Well, as it pertains to opioids, I hope they'll get a good sense of the background about how we got here, how these guidelines really are guidelines not just for opioids, but they're for good care. You know, they're really focused on measuring benefits and risks. We don't know that much about the benefits of opioids. We actually know a lot more about the risks. So there's a lot more that we can do to stay vigilant when we treat our patients. So that hopefully attendees will get a good sense of that. How the opioid crisis and the safe opioid movement has kind of evolved the standard of care, what's expected of us from our regulators in terms of prescribing, how these guidelines have been revised, as I said before, and then maybe some updates on how COVID has changed the opioid crisis. And you know, hopefully I'll be able to bring some news that's very current to the time we give this lecture.
Not all of it has been fun with COVID. So I really look forward to hearing you talk. It's going to be important for the patient or the participants in the conference. There are a lot of unanswered questions. Sometimes we think that the pendulum is swinging too far one way and then it goes too far the other way. We got to kind of find out our happy medium in a sense. I appreciate your spending time with me and sharing your expertise and your insight and your perspective. Look forward to your talk on the 12th, and thank you very much.
Thank you, Dr. Gould. I look forward to it as well.
Take care.